welcome to A2 Aesthetics, the Body Show. Today I'm here at Health Life Aesthetics with Dr. Ziyanda Ndebele and her sister Khanyisile Ndebele. And we're going to be discussing shades of beauty. Historical evidence shows that the practice of skin lightening can be dated back as far as 200 BC. Ancient Rome used honey and olive oil. Ancient Greece used skin whiteners with chalk and lead, and red lip colouring and charcoal dyes. To unearth the social and medical issues, the pros and the cons regarding this practice, I welcome Dr. Ziyanda Ndebele and her sister Khanyisile Ndebele to A2 Aesthetics, the Body Show. Thank you very much, ladies.
Thank you so much for having us.
Excellent. With all the history that has gone through South Africa and it being such a social issue, where the colour of your skin determined where you could work, how you could work, why? Please enlighten us why is skin lightening still happening today?
I mean, for many reasons, hey. Firstly, it's part of history. So we all know that history sometimes tends to repeat itself. Sometimes we just evolve, but we don't lose those maybe unlearned things we were taught. Now it's mainly because of social media, especially. It's also because of pressures of the world, really. Everyone wants to look better and more beautiful. And sometimes it can be a bit maybe a wrong view of it, but it's usually because everyone is trying to look better and feel better and to get a better job, better position, better partner. You mentioned that it is still very much because of classism. You know, we all still see the fairer skin as more better and more privileged and superior as well. So there's a lot of reasons for it.
Just in terms of the media, what role do you think they play specifically in terms of the African community? Not just in South Africa, because there are many people who've gone through skin lightening in South Africa, but it is a global issue.
Yeah.
And, you know, these are educated, successful celebrities, pop stars, icons who know that they can influence a whole younger generation.
Yeah.
They're educated and wealthy.
Yeah.
What is it about them? Is there not some sort of social responsibility of the media as well and these icons to stop the next generation wanting lighter skin?
Yeah.
I mean, definitely there is a responsibility on these individuals, but I think the most important thing is that with the media, what drives it is the perception of beauty, right? Yeah. So with every ad, with everything that is being sold out there, it's always, you know, beauty sells, you know, you're more likely to buy something when someone beautiful is advertising it. And right now we know the standard of beauty is the more light-skinned, you know, woman out there, right? So with that, if you are chosen as the model and you are the it celebrity right now and you're the light-skinned person, you're the ideal. And in honestly speaking, with these individuals, they also have their own priorities that they have to focus on as well, right? This is a business for them. This is a job for them as well. As much as you do want to influence, you know, the population to do the right things and to follow the right, you know, ways of life, you also have to understand that you have to earn a living as well. And by you earning a living, you still have to maintain the beauty. You still have to maintain the light-skinned appearance. We all see how it is with the models nowadays. Most of them are light-skinned. We don't have dark-skinned models. So, you know, if the dark-skinned models are not coming out and they're speaking for the dark-skinned, you know, individuals, you know, expecting someone who's light-skinned, who's being paid for being light-skinned, you know, we call it light-skin privilege, you know, it's not their duty to do that. So we need more of the dark skinned people to be the ones who are coming out. The light skinned
as well.
the light skinned models that we have nowadays are not going to speak out because it's their livelihood at stake. It's also their it's their job at the end of the day.
In apartheid South Africa, the skin lightening trade was rife. In 1955, the National Party brought into law the Coloured Labour Preference Act. This provided a social advantage to coloured South Africans over black South Africans. The consequences were that a person with a lighter complexion found it easier to get employment, property, education, or social advancement, increasing demand amongst black South African women seeking social approval and upliftment. So now that we're having this issue where people are getting into skin bleaching and skin lightening, what are the adverse effects? Why not to even start doing this?
I mean, there's a whole list of it. We start with systemic as well as local. Local, after some time you can have the thin skin, you can have the redness, the sensitivity, you can have the pigmentation problems now coming through. You can have in time, long term, the skin cancers. You can have the systemic complications, which now we're speaking kidney damage. We're thinking hypertension, things like that, weight gain, acne. So those are the immediate and for sure side effects from skin bleaching. The ones we are very concerned about are the ones that we can't reverse, or the things where will cause a lot of damage and you won't go back to your normal baseline. As well as things like skin cancer, because that is a preventable thing. So we're trying to prevent the skin cancer from coming about, and skin bleaching makes it very difficult, especially if you don't know that with skin bleaching you must always use sun protection, and you must always use sun protective things, so wearing the long shirts, the umbrellas, the hats, the caps, being in shaded areas. So you must take extra precaution. So and those are the main ones.
And I think in terms of the side effects, I think it's very important to always know that the duration is what matters, because a lot of these products are given for
medically as well,
and we give it to you for a certain duration so that we can prevent side effects, right? But then once you start using it beyond that period, that's when the side effects start coming about. So we're not really talking about like hydroquinone, for example. Hydroquinone is a product that we use for hyperpigmentation. There's nothing wrong with using hydroquinone when it's prescribed by a doctor, and we know that there's a maximum duration that we can treat you on it. But things like getting these backdoor bleaching agents where there's still mercury in it, and all of mercury is something where just one exposure you can get kidney damage, one exposure you can get severe hypertension, liver toxicity. So it also depends on which agents you're using. Are you injecting these bleaching agents? Is it something that you're applying on your skin? Are you drinking tablets? There's different ways in which you can bleach your skin nowadays. So it's very important to identify which route are you using to bleach, and then looking at those side effects afterwards, because they're not always going to come about the same time or the same way or the same severity.
No, I understood, and that's very interesting what you're saying, Doctor, because I was reading it's in 1975. So this was still during apartheid, where mercury was banned in skin lightening creams. So it must have been so bad for even the National Party government to even think about banning it then, because it wasn't top of their agenda. And you're saying to me it's still available in South Africa?
It still is, because a lot of these products are actually banned. But they find their way here. And when they test it, you still find that there's still traces of lead in it, there's still traces of mercury in it. So, the more acceptable ones are the ones with the steroids and the hydroquinone, but you still get mercury. But, unless you test these products, that's the only time you'll actually see that there might be mercury in it.
Yeah.
But if you don't test it, I think it's incorrect of us to assume that there's no longer
not
mercury in the bleaching agents. Yeah.
Following on what you were saying, in terms of the treatments available, is it just topical or intravenous? Because I've heard stories about people going onto drips and suddenly they're 20 shades lighter.
Yeah. There's been new
How does that work?
formulations. Yeah, there's a lot more new formulations. You know what? The skin bleaching industry is huge.
It's huge.
Lots of money involved in it because a lot of people are actually doing it, and a lot of celebrities are doing it. A lot of wealthy people are doing it.
Not regulated as well.
Exactly. You have a lot of people in the royal families who are also doing it as well. So there's a lot of money in it. What you actually start to see is that sorry, I lost my train.
Is that our South African royal families?
I mean, not just South African,
but like everyone.
Okay.
Throughout Africa, from north all the way down to south.
Yes.
And I mean, it comes in forms of all different types. So now there's soaps, there's your serums, there's your moisturizer, there's sunscreen with bleaching things inside, and then you're thinking, okay, but how? Okay, exactly. And then as well as powders for you to drink, tablets. There's IV now, and then I mean, we were discussing it, and we were shocked to think you will see this blue bag. And then you find with whatever blue thing that's in there to go inside your bloodstream. Yeah. And then you're thinking, but what is it doing?
Yeah.
Already you're thinking the colorant is bad for the liver, for the kidneys. Yeah. And then there's still the breaking down of it. And then there's so much to it. So now you're thinking it's not just a drip that's making your skin light. There's also things that need to be broken down from that chemical that's used, So there's so much to think about as well. But the drip one is the one that's now very famous. And very quick as well.
I've heard that. Is it safe?
Well, depends where you go.
Yeah.
So skin bleaching, you can do it. Just know that it's very expensive and it must be supervised. And it must be done with a doctor. So either a GP or a dermatologist. But it can't just be just skin therapist or someone who just, thinks that, oh, my skin is beautiful, let me just do this. It's not about that. You need to know what is inside it and the consequences of that inside the body as well.
Yeah, because we have to be monitoring the kidneys.
Yeah.
We have to. That's the most important thing, the kidneys. It's the kidney failure that causes a lot of these patients to demise. And we have to be monitoring, because if we're giving your body high dose steroids, high dose, because everything is high doses. That's how they get, these results quite quickly.
Yeah, the maximum results.
High dose. Yeah, so we always have to be monitoring the kidney function, because that's the first to go, always.
Wow, how interesting. The next question I suppose I want to ask, the percentage rate of success. I'm presuming once you've been on this very expensive drip and you come off, then the results stop.
Yeah, essentially.
Essentially. So
so it's an ongoing thing.
Ongoing.
So it's lifelong.
Yeah.
Basically, it's a chronic treatment that you must have every single time.
So that's why we always say you have to do it with a professional, because there's an initiation phase where you're starting to reduce the
slowly
introducing slowly introducing the bleaching agent, calming those melanocytes down so you don't have the rebound pigmentation, protecting the skin barrier, protecting it from damage. And then you just maintain the results afterwards, because we understand that the point of bleaching is that we're actually getting rid of your melanin, right? But naturally, melanin is a protective mechanism. So your body will always produce melanin. The only time your body stops producing melanin is if, you have vitiligo, but that's a completely different condition. It's if we kill the melanocytes with what you get with ochronosis as well, which is a complication of chronic use of hydroquinone. So that's the only time your melanocyte is not going to kick back, right? So you know that if melanin is going to be produced again, you're just going to get dark. You go out into the sun, you get a bit of a tan, you're going to get dark again. So you have to be maintaining the results. You always, that's the one thing that all of them complain about, that but doc, I bleached my skin, I was beautiful, I was light, but now I'm dark again. That's because you can't stop. Once you start, you have to continue. It's a lifelong thing. Lifelong commitment.
So it's quite a psychologically expensive
Very.
treatment.
Very.
Wow. The next thing, in terms of people just getting from spice shops, even your basic
Take a lot.
Takealot
Yeah.
or online. I don't know if I can say Takealot. You're online.
Yeah, Instagram.
Instagram. I mean, I've seen things on Instagram that you can buy and they promise you the world.
Yeah.
So it's available. If you want it, you'll get it.
Yeah.
But consumers don't always read what's in the box.
The ingredients.
Yes.
Yeah.
What should consumers be looking out for if they are going down this route, which is completely not recommended at all? But these are the red flags.
I mean, look, we've found that a lot of these labels, they'll leave a lot of things out.
They do.
And because they know that hydroquinone 2% is allowed, they all label
Say 2%.
hydroquinone 2%.
Okay.
But we actually found that one of the ones where studies were done, it was actually more than 6%. But on the label, they said 2%. So you're looking at things like parabens, no. Things like cortisone, corticosteroids, no. Lead, absolutely not. Mercury, no. Hydroquinone, more than 2%, no. But also, if it's not from a doctor or from a medical place,
rather
a
not
question,
use
where did they
hydroquinone.
formulate it?
Yeah.
Is it real? Were studies done? Can we have the actual testing labs ingredients before we can see the label? Because anyone can fake a label.
Yeah.
But those are the things that they must look out for. Things like vitamin C is allowed. Things like kojic acids and things like that. That's safe to use. But everything else, no.
So what you're saying is if you want to go down this route, you definitely have to have a medical opinion first.
Yeah.
And be educated about it, because there's
Do some research.
huge side effects
Yeah.
going through the other way. And I think this is going forward because there is a prevalence of a youth generation
Yeah.
wanting to be lighter. And just on reflection, can you just sort of speak about the social scars that bleaching has put on communities? And why are people still carrying on with it?
I mean, that is a very loaded question, purely because some people come and actually tell us, like some teenagers will come and tell us that my mom actually always compares me to her and my sibling who's light skinned, and I'm the dark one. So she's the one who sent me here so that I can actually lighten my skin. So it starts becoming difficult with teenagers or the young mind, because sometimes they see it from their siblings, from their parents and stuff, and they actually push them to do it. So the scoring comes in, but I need to do this because then I'll be accepted into the family as the beautiful cousin, as part of, the light-skinned clan, In terms of the other side, I mean, they are left with burnt skin. They're left with the red skin. So now that lack of confidence, that they just always feel left out, because once you know how a bleached skin looks, you will always be stigmatized.
Yeah.
And they will always say, yeah, but you bleach your skin, so you shouldn't talk. Yeah, but you bleach your skin, this and that. So it also comes back to bite you, because it's still technically a stigma. So people punish you for doing it, but then you're also punished for not doing it. Exactly. So it's a catch-22. So it depends on the environment you're from. Most of the time, I mean, we're from a dark-skinned family, so we were always confident, encouraged to love our skin and to, be bold in our skin. So we never really felt, I mean, you'd hear comments here and there, but it doesn't affect you because you're confident, But for the next person, it's more about, are they strong enough to take that sort of bullying about their skin tone to say that actually I love my skin tone. I don't care about the bullying. But a lot of kids don't have that. They actually succumb to it and then they start doing it and start buying from, I mean, a lot of them, they make a joke. They say, I buy from my friend. You know, the side shops and puzzles or whatever, they sell them too. Because they know that teenagers now also want that nice, radiant, luscious skin. So they sell it to the kids as well.
And I also think with the teens, I mean, you did touch on it, like with the bullying, but I think as a teen, we all remember when we were 12, 13 years old, 14, around there, you know, you're starting to become more curious about the opposite sex. You know, you're dating more. There's Valentine's Day that's coming. No one's asking you to be a Valentine, but you see the light-skinned people being more prioritized by your peers. So you also start to think, maybe if I just went a bit lighter, maybe I can get a boyfriend, maybe I can get a girlfriend as well. So that's what really pushes the teens too. As well as the fact that as a teenager, you know, you're already starting to get acne and the pigmentation. So once again, a lot of them are seeking just healthcare solutions for their problems. So a lot of them, you know, will hear from someone, oh no, you just go and buy this cream from, you know, just that supermarket over there. I promise you your acne will go away, the pigmentation will go away. And it does. But it's a problem of continuing with it afterwards. So there's a lot of social reasons as to why the teens are doing it. And it's quite difficult with also navigating through social media because, you know, the Gen Zs and the new generation, they're all about what I see on TV is basically what applies to my life. And if the only thing we're seeing is beauty, light-skinned people, and they're the people who are getting the praise, you know, we can't really change their minds because that's what's drawing them. So yeah, it's quite, they're the most challenging population to actually get through. Because they have a lot, they're still learning themselves and they're still identifying themselves. They're still trying to, you know, form an identity and they're trying to see, can I take this from this person? Let me take this from here, whatever. So they're very impressionable and it's quite difficult for us to change their thinking with regards to bleaching. But that's why with them, we just always tell them education, education, education. No matter what you do, use sunscreen. If you start to see this, go and see a doctor. If you start to see that your acne is coming back and it's worse than it was before, go and see a doctor. That kind of stuff. So it's more just about education and letting them know that, look, there's always a door open for you in terms of the teens. Yeah.
No, wonderful. Absolutely agreed. Education. Educate yourself about anything you don't know about.
Yeah.
Yeah. Fantastic. I just want to ask, so that's in terms of the teenagers. Theoretically, if you've had a more middle-aged woman who has for 20 years been getting from the sponsorship, looked fabulous for 10 years, and now has gone into this crisis of almost like skin lesions.
Yeah.
Can it be fixed? What can be done?
So, I mean, with those patients, you have to go straight to full clinical examination.
Yeah.
Because once they've been on it for a very long time, you're starting to think what systemic side effects are they starting to have now. So we are more concerned about what is in your blood, how are your organs doing. So with them, we always do like a full workup. You know, if there's any new lesions that we're starting to notice, if something, you know, we're suspecting a bit of malignancy or cancer there, then we have to do biopsies. You know, but most importantly, we while we are doing those life-saving measures, such as, you know, making sure that the organs are still working well, the kidneys are still fine, they're not hypertensive, and that they don't have any pre-malignant lesions, we care for the skin as well. We have to repair the skin barrier always. Because we understand the main reason why they started bleaching it. It's always about how you look, right? So you must still maintain that, because I think what's more distressing for them when they come later on in life is because the bleaching products are no longer working. Not because of the lesions that they have, not because they now, you know, have ochronosis, that they have that stubborn pigmentation. It's not because of that. It's just because, well, doc, now the stubborn pigmentation is here and the bleaching products are not working. It's not because they're concerned about
the complications per se.
It's more because nothing is working for the pigmentation anymore.
So yes, some skin lesions we can reverse, others we cannot. And that is then a dermatologist as well as a plastic surgeon's area to see what they can do.
So it can become that extreme that you have to have lesions cut out on your skin.
They have to.
All due to bleaching for numerous years.
You can't not biopsy any lesion that comes out on the face or on a skin that's being bleached. You have to. Because melanoma is very high. And a lot of the times, by the time we see, because a lot of people just see that, that mole there and they're like, oh,
and they think it's just a flat spot.
Yeah,
that's
all it is. But, melanoma spread inwards. They don't spread outwards. So by the time we actually do the full workup, x-rays, the works, it's metastasized, it's in your lungs, it's everywhere. It's advanced disease. So, it's very important that they must be doing this with a healthcare professional.
Yeah.
You must be getting checked. You have to be honest with the doctor that you're seeing. We're not here to judge you. We're here to help you. So you have to tell us. But it's easy for us to pick it up. We take every opportunity to ask patients, what do you use on your skin? Are you using sunscreen? You can pick up a skin that's bleaching quite quickly.
You can, the dark knuckles and everything.
Dark knuckles. Yeah. The veins that are now visible, and you just ask. Don't upfront say, "Oh, are you bleaching your skin?" Just say, "Oh, what do you use for your skin?" And a lot of patients will tell you what they're using for it. Then you're like, "Oh, have you ever used steroids? What do you maybe know what's in your products?" Just so that you're able to help them and let them know that okay, you need to start using sunscreen now. You need to be careful of this. So
everybody should be using sunscreen anyway.
Everyone.
Okay, I'm a huge advocate of sunscreen.
Yeah.
Perfect. Thank you so much for a wonderfully informative interview. To our viewers, always consult a qualified medical doctor before embarking on any procedure, no matter what it is. From me, Rachel Tambo, and the 8-year Aesthetic, The Body Show, thank you for watching. Please like and subscribe. And keep living your best life. Thank you.